Have you ever been in a situation, maybe with your own health care or helping out a family member, where it just felt like the different doctors, nurses, therapists,
Yeah.
they weren't quite connecting? Like they were great individually, maybe, but the team wasn't really a team.
Yeah, I know that feeling.
One person saying one thing, another saying something a bit different. It can be confusing, right?
Yeah.
And honestly, kind of worrying when it's about someone's health.
Well, that disjointed feeling is exactly what collaborative practice in healthcare is supposed to fix.
Right.
The whole idea that professionals from all these different fields, medicine, nursing, social work, PT, admin, you name it, must work together effectively. It's seen as, critical for patient care now.
Yeah. Seems obvious, doesn't
It
it?
does.
And you'd think, wouldn't you, that by now we'd have this, universally agreed upon list of the absolute must-have skills.
A roadmap.
Exactly. A clear roadmap. Maybe something taught consistently in school, even. But apparently not. A single, widely accepted framework. It's been surprisingly elusive.
And that's a real problem, you see. Because if we don't have a clear picture of what the most important skills for collaboration actually are, well, it's incredibly hard to train students properly.
Or support the teams already working.
Right, or support existing teams effectively. You're kind of aiming at a moving target.
Exactly. So the material for this deep dive, it really tries to tackle that challenge head on.
How so?
Well, instead of just relying on, academic theory or committees, this study went straight to the source.
For the front lines.
Yeah, they interviewed actual healthcare professionals, 60 of them actually, across different jobs and places, and just asked them,
Okay.
what from your day-to-day experience are the most essential skills, the things that make collaboration actually work for the patient?
So the goal was to get that ground-level perspective, to understand what the people doing the work every day felt were the core ingredients, the things that truly impact patient-centered care and how the team functions.
Okay, let's unpack this then. Our mission today is to dive into those insights from the frontline workers. Right, to see what really rose to the top as the absolute core skills and maybe understand why focusing development efforts there might be the most powerful way to improve things.
Improve patient outcomes.
And the lives of the professionals themselves, yeah.
It's a fascinating angle, definitely, looking at what the people actually doing the work prioritize.
So maybe just quickly first, why is this collaborative, patient-centered way of working so fundamental now?
Well, at its core, it's because healthcare has just gotten so incredibly specialized.
Yeah.
And complex.
Right.
No single professional, no single discipline has all the answers or all the skills needed to meet all of a patient's needs. You need the doctor for the diagnosis, sure, but also the nurse for the direct care, the therapist for rehab, the social worker looking at support systems.
They all bring a crucial piece of the puzzle.
Exactly, vital pieces.
And the study really makes a point that it's not just about the professionals, right? It mentions the patient, too.
Oh, absolutely. The patient is a critical part of the team. They bring their own expertise about their life, their condition, what matters to them. It's about valuing everyone's contribution.
Including the person getting the care.
Definitely. And that drive to collaborate often stems from just recognizing that working in silos,
Yeah.
it just doesn't cut it anymore. It can't provide the best, most complete support.
Okay, so when these professionals, the ones living this reality every day, were asked about the skills needed for collaboration to work well, what came out on top? What did they consistently point to?
Well, you could list dozens of qualities and skills for good teamwork.
Sure.
But the study found that two specific competencies just emerged again and again, consistently from these frontline interviews, as being the most crucial.
Okay, the two essential pillars were?
Number one, understanding and appreciating professional roles and responsibilities.
Okay.
Role understanding. And number two, communicating effectively.
Role understanding and communication. On the surface, that almost sounds, I don't know, a bit basic.
Deceptively simple, maybe.
Yeah, isn't that just basic professionalism?
Yeah.
But I have a feeling digging into what that really means day to day, that reveals a lot more complexity.
It absolutely does. Let's take that first one. Understanding and appreciating professional roles.
Right.
This isn't just like reading a job description. It's about truly getting the unique value and expertise that someone from another field brings.
And understanding what they actually do.
Exactly, what they do in their day-to-day practice.
And the study participants, they talked about struggling with the how-to of it all.
Yeah.
Right? Even if they knew they should collaborate.
Precisely, like figuring out where they fit in a team,
finding your place.
Yeah, there's this quote from a social worker in this study that really stuck with me, talking about that learning curve of where you fit into that team, especially when you're new. It's not always obvious.
I can totally see that.
Oh.
And if you're not sure of your own place or, what the person next to you actually does, that must create friction.
It does. It makes meaningful interaction so much harder.
Yeah.
And interestingly, the professionals they interviewed, they admitted they often don't know as much about other roles as they probably should.
Really?
Yeah, which then makes them realize, hey, maybe my role is misunderstood too.
Ah, that makes sense.
There's a fantastic quote from a nurse that just nails it. I'm the first one to admit that I don't know what someone else does, but don't assume to know what my job is.
Wow. That's really powerful and honest. It shows that two-way street of misunderstanding.
Mm-hmm.
And the study talks about how this lack of clarity, or even just perceived overlap, can cause real tension, people getting protective.
Yes, exactly. An administrator manager mentioned how upsetting it can be when you feel like someone else is doing what you see as your job.
That's not just academic theory, then, that's impacting morale.
Right, and teamwork suffers.
And that protectiveness, or maybe just simple lack of understanding, can mean the team isn't using everyone's skills fully.
That's a huge consequence. You don't know what someone can do, so you don't ask them, you don't tap into that expertise.
Yeah. So the team isn't running on all cylinders.
Exactly. The study participants pointed that not understanding people's full scope means the team just isn't operating optimally. The research actually uses the term role blurring.
Role blurring.
Where those lines aren't clear. And they identify it as a significant risk factor for conflict and even burnout within teams.
Burnout, wow.
Well, think about it. If nobody's quite sure who's responsible for something.
Things fall through the cracks.
Or maybe multiple people try to do the same thing, which is inefficient and frustrating for everyone.
Okay, yeah. Role blurring sounds like a bit of a minefield. So what did the professionals suggest? How do you navigate that confusion?
Well, they really emphasized needing clearly defined boundaries.
Okay.
And making sure individual contributions are demarcated, clear. One educational psychologist really stressed setting up collaboration so that, quote, the roles are clear and where those roles intersect is clear.
Where those roles intersect is clear. I like that phrasing. It's not about walls, but understood connections.
Right. Intentional overlap, not just a fuzzy mess. It's about finding that balance between interdependence, relying on each other, and still maintaining professional autonomy.
Recognizing distinct strengths.
Yes, a physical therapist highlighted that, realizing that whatever your profession was, people brought certain strengths to the group.
That balance seems absolutely key. Celebrating the individual strengths, but weaving them together. What about the different professional cultures? Did that come up?
Oh, absolutely. Big time. The study acknowledges that different sort of philosophical backgrounds can add complexity.
Makes sense.
A nurse noted that these cultures shape how people see healthcare issues. And while having diverse perspectives can be really enriching,
it takes work.
It definitely requires the negotiations between these different perspectives. That's a direct quote.
So diversity is a strength, but you have to actively bridge the gaps.
Yeah. And sometimes, according to a psychologist in the study, that very professional differentiation could actively stand in the way of professionals working together in such a way that they provided the most effective and caring patient care possible.
Wow. So the very thing that defines a profession can sometimes become a barrier to teamwork.
It gets right to the heart of it, doesn't it?
Yeah.
Disciplines need to define themselves. That's necessary, but that definition can accidentally put up walls. But here's where it gets really interesting.
Okay.
How did the professionals say they overcome these boundaries, these potential role conflicts?
What was the key?
The study found a really clear answer straight from the front lines. Focus squarely on the patient's needs.
Oh, okay.
Yes. This was such a powerful theme. Several providers mentioned that shifting the focus to the individual patient, it just cuts through the territoriality.
Takes the ego out of it, maybe.
Kind of, as one nurse put it so perfectly.
Yeah.
Because it's not about who has got the more important role. It's about how can we get what this person needs.
That perspective flip changes everything, doesn't it?
It really does.
It moves the conversation from whose job is this to what does this person need and who here is best equipped to help with that.
Exactly. Another quote mentioned specifically treating the person as an individual and asking what is important to them.
It makes role understanding a tool to serve the patient, not a shield for professional turf.
You got it.
Okay, that's incredibly insightful on why role understanding is so crucial and so complex. Let's shift to the second core competency they identified, effective communication.
Right, foundational.
The study really emphasizes this for coordinating care, doesn't it? Both provider to provider and with patients and families.
And the evidence linking poor communication to actual harm,
Yeah.
it's pretty stark.
Yeah.
The study points to data from the Joint Commission. They found communication failures are involved in roughly 65% of what they call sentinel events.
Sentinel events, those are the really serious preventable bad outcomes, right?
Exactly. Serious harm.
Wow, 65%. That number just jumps out. It's not just about things being inefficient, it's directly about patient safety.
It absolutely underscores the stakes. Poor information transfer isn't just annoying, it directly leads to lower quality care and adverse outcomes. There's other research cited, like Kripalani's study, showing this.
So the conclusion is pretty clear.
Unambiguous, really. The Canadian Medical Protective Association is quoted saying, "Poorly functioning teams, in particular poorly communicating teams, increase the safety risks for patients."
So communication isn't just a soft skill here, it's a hard requirement for safety. What specific communication challenges did the professionals in this study mention?
Well, some mention people not feeling comfortable speaking up about their roles or their expertise.
So it links back to the first point.
Definitely ties back.
Hmm.
Others just noted how a simple lack of communication actively blocks collaboration. They also talked about difficulties clearly articulating their own contributions, or even like effectively delegating tasks.
And effective communication in a team like this. It's not just about passing on facts, is it? It's managing different viewpoints, different personalities.
Absolutely. Skillful negotiation came up.
Negotiate.
Yeah. When you have those different professional cultures we talked about, or just different personalities, that nurse quote again, effective collaboration requires the negotiations between these different perspectives.
Right, and sorting out disagreements as a team before you involve the patient or family, that seems crucial.
Critically important.
Yeah.
A social worker in the study really stressed that if there is conflict and just outright disagreement, I think that is something the team needs to work out before the patient necessarily is involved.
Because presenting that united front builds confidence.
Exactly. Reduces anxiety for the patient and family, seeing your care team on the same page, that has to feel safer.
Totally. The study also mentioned adjusting language
Ah.
and cross-cultural communication.
Yes, being able to tailor your language.
Yeah.
You know, the terminology you use depending on who you're talking to.
Patient versus another specialist.
Right. Or a family member. That's key. And of course, treating everyone with respect, whatever their cultural or linguistic background, that was rightly highlighted is just fundamental.
And education helps with that skill specifically.
Apparently so. A rehabilitation assistant in the study gave credit to their schooling for helping them learn how to adjust their communication style and terminology effectively for different clients and team members.
Okay. Were there any specific practices that help things teams do that foster better communication?
Yeah, team rounds came up a lot.
Yeah.
And charting.
Rounds, okay.
A respiratory therapist described rounds as that crucial time for the team to get together, discuss the patient, get aligned on the plan for the day. They asked the key question. If you're not communicating with one another, how are we all figuring out the best plan or the goal for that patient?
Makes sense.
So those practices are seen as like the engines for coordinating care and making sure information gets shared.
So role understanding and effective communication, those were the clear, consistent top two from the frontline folks. But the study also mentioned other qualities that came up, even if they weren't categorized quite the same way.
That's right. They also talked about, the importance of building trusting and respectful relationships.
Foundational stuff.
Yeah. And having a commitment to continuous learning and reflection. And maybe most importantly, just a basic willingness to learn and change.
That willingness to change, that feels like it could be a big hurdle sometimes.
Oh, definitely. The study quotes a rehabilitation assistant talking about people who are just used to doing things just one way.
And how that can block new collaborative approaches.
Exactly. And reflection was highlighted, too, as a really valuable practice.
How so?
As a way to consciously think about who else needs to be involved in a patient's care, and also as a process for learning from others' perspectives.
Learning from mistakes or different viewpoints.
Yeah, a chaplain shared how real learning often came from those experiential moments, followed by debriefing and reflection. hearing how their actions impacted care from someone else's point of view.
So it sounds like maybe communication and role understanding were seen as the core trainable competencies, whereas things like trust, learning, willingness to change, there may be more like foundational attitudes or ongoing practices that allow those core skills to actually work.
That seems to be how the study authors kind of interpreted it. They saw those other elements more as antecedents.
Antecedents.
Yeah, like individual characteristics that make someone ready and willing to collaborate in the first place, often driven by that patient-centered vision we talked about earlier.
But it can't all just be on the individuals, can it? The workplace, the system that has to support this too.
Oh, absolutely crucial. The study makes a big point about the environment.
Okay.
The workplace itself has to actively support and foster collaboration. It needs to provide the actual time for it.
Time is huge.
And the resources needed, encouragement from leadership, and really clear expectations about what collaborative practice even looks like there.
And fascinatingly, this study also found that just a lack of clarity about the term itself, collaborative practice, could be a barrier within an organization.
Yeah, that's interesting. One health education administrator mentioned that while words like teamwork were thrown around a lot, they felt like, quote, old words, old meanings. They admitted they weren't that clear about what we mean by collaborative practice in their specific place.
Wow. So if the definition itself is fuzzy within the system,
it's incredibly hard for individuals to know how to do it well or for the system to even support it properly.
That makes perfect sense. How can you practice something consistently if the goalposts are vague?
Exactly. And this kind of brings us back to the bigger picture, doesn't it?
How so?
Well, while the academic literature might list, tons of competencies for collaboration,
Right.
the really striking thing from the study asking the people on the ground is how consistently they distilled it down to those two core areas, communication and role understanding.
Even though, as we've discussed, those two things are actually pretty complex and layered.
Oh, for sure.
No.
Far from simple. And the study notes the academic challenge this creates. If practitioners prioritize these two key areas, but the academic frameworks or the training programs list many, many more, how do we make sure training is actually aligned with what makes a difference in practice?
Bridging that gap.
Right. There's a need for more clarity on sort of the active ingredients of collaboration, the things that demonstrably improve patient outcomes. Schmidt's point, mentioned in the source.
And that's where the power of the study's findings really lies, isn't it? Focusing on communication and role understanding isn't just like an opinion from the front lines.
Yeah.
The study points out there's already strong evidence linking these two specific areas directly to better patient outcomes.
Reducing errors.
Improving care quality, avoiding duplicated tests or treatments.
And also importantly, better outcomes for the providers themselves.
Like job satisfaction.
Higher job satisfaction, better recruitment, better retention, all linked back to getting communication and role understanding right.
So while effective collaboration definitely needs supportive environments and those foundational attitudes we mentioned,
all right, the whole package matters.
the professionals actually doing the work seem to have identified the fundamental leverage points, developed these two core skills well.
And you create significant positive ripple effects for patients and for the healthcare team itself.
So the core takeaway from this deep dive seems really clear. When you ask the healthcare professionals working directly with patients day in, day out, what skills are the most essential for working together effectively?
They point overwhelmingly to understanding each other's roles and communicating well.
In strengthening these two areas, it's not just about, smoother team meetings or clearer handoffs.
But it's much bigger than that.
The evidence and the frontline experience show it has this tangible, significant link to safer, higher quality care for patients.
And a more sustainable, more satisfying way to work for the people providing that care.
So, if understanding professional roles and communicating effectively are seen by the people delivering healthcare as the absolute bedrock skills for collaboration, what does that suggest then, about how healthcare education should maybe be structured?
Good question.
Or how hospitals and clinics should actively support their teams in the day-to-day work. And maybe even what could you, as a patient or someone involved in care, what might you observe or even ask about to encourage the best possible collaboration from your own care team?
Yeah, how can we make sure the system truly prioritizes these foundational elements?
That's the thought to chew on, isn't it?